তাহলে ও করতে চলেছে, দিস ইজ গোয়িং ফর দ্য হুইসপারিং টেস্ট। হুইসপারিং টেস্ট ইজ ভেরি ইম্পর্টেন্ট বিফোর এনি অডিটরি টেস্ট। হ্যাঁ, তাহলে এক্সামিনার একটু বলতে হবে যে স্যার আই ওয়ান্ট টু স্টার্ট দ্য ওয়েবার টেস্ট প্রপার বিফোর আই ওয়ান্ট গোয়িং টু দ্য ইয়ের টেস্ট আই ওয়ান্ট টু ডু দ্য হুইসপারিং টেস্ট। হ্যাঁ, নইলে কোনো কোনো এক্সাম হবে যে এটা আবার কেন করছে, তাহলে এটা কি ওয়েবার টেস্ট ভাবছে? বোঝা গেছে? এইটা হাতে আগে নিয়ে নিবি, এটা আগে হাতে নিয়ে নিবি, মানে এক্সামিনার বুঝলো যে হ্যাঁ ইউ আর ইন ট্র্যাক, দেন গো ফর দ্য হুইসপারিং টেস্ট। বলতে থাক, আরে তোকে বলতে হবে, উচ্চারণ করতে হবে ও কি বলছে, কোনো একটা লেটার, ওয়েদার এটি ওয়ার্ড। কিন্তু আমি শুনতে পাচ্ছি রে, আস্তে আস্তে দূরে যেতে হয়। এখানে একটা বলা হলো ওয়ান, ওখানে বলা হলো এটা বি। হ্যাঁ ঠিক আছে, দেন বাইল্যাটারালি, আগে সামনে। হ্যাঁ ঠিক, দেন গো ফর দ্য প্রপার ওয়েবার টেস্ট। তোর রোল নাম্বার কত? হ্যাঁ 90। That means he has no ear deficiency. If it is lateralized, means what? If it is, suppose she is telling that right side he is taking the more sound, মানে towards ear means conductiveness, and away from the ear it is called sensitiveness. Very good, ঠিক আছে, চলে আয়, বসে পড়, চলে আয় তুই। তাহলে এক্সামিনেশন অফ 9, 10, 11, 12 যারা প্রেজেন্ট ছিলি না, কীভাবে হবে? ফার্স্ট অফ অল হিস্ট্রি। হোয়াট আর দ্য হিস্ট্রি ফর 9, 10, 11, 12? এনি আইডিয়া? হোয়াট শুড বি দ্য হিস্ট্রি অফ বিফোর? হ্যাঁ হ্যাঁ, টেল মি। হ্যাঁ, হোয়াট ইউ ক্যান সে? 9, 10, 11, 12 means what are the names? Glossopharyngeal, vagus, spinal axillary, hypoglossal. Hypoglossal means supplied only the tongue, right? Spinal axillary means shoulder and what? Well, sternocleidomastoid. Then vagus means larynx, larynx, pharynx, vocal cord, mucous membrane of these areas, all are supplied by vagus. And the glossopharyngeal is a mixed nerve. Glossopharyngeal is a mixed nerve, sensory and motor. What are the roles of sensory? Is glossopharyngeal? Posterior 1/3 of the tongue supplied by the glossopharyngeal for the taste. Taste means bitter, sour, sweet. So this is a glossopharyngeal. So before the going for the proper taste, you have to go for history. History means what? Taste. First of all, taste whether any problem is present or not. Number one. Number two, vagus. Vagus কি করে? To prevent the regurgitation of food. তাহলে আমি জিজ্ঞেস করতে হবে যে কোনো খাবার বাইরে মুখে দিয়ে বেরিয়ে আসছে না, whether any problem or food is coming out or not present. During speech problem, phonation, এই যে কথাটা বলছি আমি, এই যে ওয়ার্ডটা, that is due to our vocal cord. Vocal cord modulation is going on, and vocal cord is supplied by the vagus nerve, right? So vocal cord modulation, whether voice is changes, that is hoarseness of voice is present or not. Hoarseness মানে হাসপাস করে একটা আওয়াজ, this is sound is going on. That's due to the tumor, due to the polyp, vocal cord tumor, and also the your thyroid problems may cause. So this history is very important. Tonation, phonation and tonation, nasal tone আছে নাকি? Then these are called the regurgitation of food history, yes or no. If any problem that you are taking in water and water is coming out through your nose, there is also history. Any problem of voice is present or not, right? Because in case of glossopharyngeal and vagus, one important test may be asked verbally, that is called gag reflex. That is called gag reflex. What is this? Gag reflex afferent is glossopharyngeal and efferent is vagus, right? Afferent means whenever you are touching, nobody will ask you to go for the vagus test, right? Vagus test is basically theoretical at this level. Vagus test, gag test is the gag reflex done by tongue depressor, and a swab stick will be there, and the stick will be touch the posterior pharynx. Whenever you touch, he or she will be cough. So that is the gag reflex. Afferent is glossopharyngeal, but efferent is your vagus, right? Number one. Number two, for your examination of vagus and glossopharyngeal simultaneously, you have to check your palatal movement. টর্চ নিতে হবে, টর্চ নিয়ে মুখটা হাঁ করে জিভ বের করে করে আওয়াজ করবে। সো ইউ হ্যাভ টু আস্ক ইউর সাবজেক্ট টু টর্চ দেয় হচ্ছে মুখ করছে yes. So whenever you are saying, whenever you seeing your palatal movement, that is you have to say that means movement of your palatal arch will be there. Any deviation means this side, if it is paralyzed, then that side will be deviated, right? উল্টো দিকে হবে না কিন্তু, যেদিকে গেছে সেই দিকেই deviations. Number one. Number two, gag reflex is not done. Other tests are posterior pharyngeal test, that is use of some quinine, bitter and your sour, that cannot be asked in your exam, but only know that glossopharyngeal is our mixed now. Mixed means what? Motor and sensory both are there. For the glossopharyngeal, sensory part is the posterior 1/3 of the tongue. Finish. And the muscles are like these are palatal muscle is supplied by the glossopharyngeal now, right? Then the vagus or glossopharyngeal will be all over the history, and then examination only these tests, two tests are there. Only the that is a position you are taking, the uvula positions, uvula is there, and the palatal arch. যারা টর্চ নিয়ে এসছি, মোবাইল নিয়ে এসছিস, দেখ করে আওয়াজ কর, দেখ মুভমেন্ট হবে। হ্যাঁ করো, ऐसा टांग निकालो, आवाज अच्छा से हो रहा है. And uvula is in central, right? Central position. If it is deviated, then that side is paralyzed, right? So this is very important. Now number spinal exercise. Spinal exercise is supplied by কি বললাম, trapezius muscle and sternocleidomastoid. How to test? You have to go for your back side, right? First of all, you have to take consent, interactions, then only patiented consent, then touch. আমি তোকে এরকম করে এটা নামাবো, তুই এটাকে নামতে দিবি না, ঠিক আছে? ওকে, ফাইন. You have to understand that you have to constantly resist my movement. You upward movement on your shoulder, up. Yes, this is your spinal exercise, right? তাহলে whenever I am asking to resist my movement will be downward and his or her movement will be upward, and that will be resisted. Your movement will be upward. Go upward. So this, আমি এই যে ঠেলছি, this is one is your resistance I am giving. That is your trapezius muscle is correct. So that means spinal part of the accessory. Accessory now is spinal part, and also is a motor part. Is no question of cranial is a motor part. These are only the spinal exercise muscles, and also the trapezius. How can you do that? Trapezius functions key. Trapezius functions means flexions is helpful for our both sternocleidomastoid helping our flexion, and this movement is helped by this side, and this movement is helping by this side. So three tests will be there for the sternocleidomastoid. Number one, we will give resistance for the flexion, right? So that will be prominent, and so the both sternocleidomastoid muscle supplied by the spinal exercise now is acting simultaneously and together, right? তাহলে we will try to flex. Again, I am coming in the right side of the subject, right? You have to down this chin, and I will resist that, okay, like that. Yes, this is the resistance, and so this sternocleidomastoid and this side will be active, and so remember our flexion movement held by the both sternocleidomastoid. And now this movement. So I will resist in this side, you will resist, okay, resist it. This side will be prominent, that prominent. And also in this area, yes. So this area will be addicted. So contraction will be in case of sideways movement by the opposite sternocleidomastoid. But in case of flexion, both sternocleidomastoid is acting simultaneously. So these two tests, 3 to 4 tests, that is trapezius, this type of movement, this resistance, khatam. Okay, and then for the hypoglossal means tongue. Now you have to take some history for the tongue. Number one, you have to ask that you protrude the tongue. Samne elo, that means movement is there, central in position, not in the any deviation. Remember, if tongue is deviated in that side, that means pushing effect will be there. Pushing effect, ঠেলে দিয়েছে. So this side will be paralyzed. So tongue will be deviated in the paralyzed side. বোঝা যাচ্ছে? মুখেরটা আলাদা, ফেশিয়াল নার্ভের ক্ষেত্রে কিন্তু অন্য. That is a pull effect. যেদিকে প্যারালাইসিস সেই দিকে মুখের ফেশিয়াল নার্ভের প্যারালাইসিস. Suppose this right side facial nerve paralysis is there, so your angle of the deviation will be like that. Facial nerve paralysis is this pulling effect will be there for these unopposed actions of this here. This is paralyzed. This is unopposed action for the facial nerve. But for the tongue, if it is deviated in the that side will be paralysis. This is your pushing effect. So pulling effect and the pushing effect very important. Number one. Number two, you have to tell that you move your tongue inside your mouth. So what is heart doing? The motor functions, the movement is doing on. Outside your tongue, you have to check the muscle bulk. Any fasciculation. Fasciculations means movement, involuntary movement of tongue. Involuntary movement. Just like that. If it is present, it is a feature of lower motor type of lesions. Now question is, what do you mean by lower motor neurons and upper motor neurons? Anyone? What do you mean by upper motor neurons and lower motor neurons? এগুলো পড়ানো হয়েছে, facial nerve পড়াশোনা পড়েছি. What do you mean by that? Upper motor neuron means cortex to the nucleus and up to the anterior horn cell. And from the anterior horn cell of the spinal cord up to the peripheral nerve, it is called lower motor neuron lesions, right? Lower motor neurons. So if any site of this area it listen, that is called lower motor type of lesions. And if it is from the cortex up to the nucleus or the cranial nerve nucleus or the brainstem, and also up to the anterior horn cell of the spinal cord, that is called upper motor neurons are there. Okay, so this is upper motor, this is lower motor. So if any patient is having fasciculatory movement, fasciculation, this is called fasciculation, right? F-A-S-C-I-L-L-A-N-G, fasciculation. But fibrillation is different. Fasciculation, C-U-L-A-T-I-O-N. Fasciculation is a feature of lower motor neuron, but it may be present in normal subject. বোঝা গেছে? During some examination, some of your students are there. The fasciculation movement will be there. That is a physiological, not abnormal. But still, you have to inspections. During the inspection, you have to check the muscle mass, muscle growth, whether muscle big or small. Why? Because large tongue is some disease like acromegaly, right? Like your thyroid problem, hyperthyroidism. In these cases, like your sarcoidosis, these diseases will be large tongue. Okay, similarly low tongue is a dwarfism, hypothyroidism, Down syndrome. Down syndrome is a large, not small. Down syndrome, large, acromegaly, large, sarcoidosis, large. So large tongue will be there, tongue অনেক বড় আছে. And some of the lower tongue is a small tongue. So during inspection it is most important. Now you have to check for the palpation. Palpation means what? See, you have to move like that. You will oppose. I will touch here to press there. You have to oppose. Like, go, do it. Yes. So muscles bulk is it and muscle power is much more important. And bilaterally always. And try to in both sides. Check again in this side, this side, this side. Yes. So both side is to check for your muscle. Another ঠেলছি, আমি ঠেলতে দেব না. I will resist for this pushing out. That means motor power of the muscles of tongue is absolutely okay. বোঝা গেল? তাহলে whenever you are dealing in protrusion, আমি যে সামনের দিকে টাংটা বের করছি, that means my muscles are absolutely okay and the tip of the muscles, genioglossus muscles is okay. Protrusion এ genioglossus muscles is helped. এটা হেল্প করছে কে না, genioglossus muscles. Already have you learned that anatomy? Any? No. So this is very important. Whenever you are going for the face and neck, these muscles will come, genioglossus muscles will help. So glossopharyngeal, vagus, spinal accessory and your your hypoglossal is this. Is very easy. So in your exam they can ask only the palatal movement. That means you have to stand there and your torch will be there and you have to say that you have to आवाज करबे sound, tongue bahar nikalo. So that is your palatal movement will be there. Gag reflex, generally nobody will ask you, but if it is asked, এমন নয় যে তোরা ভ্যাগাবন্ডের মতো ধরে দিচ্ছিস। Bex means you have to go some instruments. What are those? Spang, tongue depressor will be there, swab stick will be there, then only you can do that test, otherwise no. Okay, so that is your essential part of this glossopharyngeal etc. Touch a test sensation for the glossopharyngeal posterior 1/3 cannot be asked because beta test nobody asks, but it can be examiner can ask you that the glossopharyngeal is a sensory nerve or the mixed nerve or the your pure motor nerve. It is a mixed nerve because it has a sensory supply of the posterior 1/3 of the tongue is supplied by the glossopharyngeal. Similarly, that will come as a then anterior 2/3 is supplied by facial nerve. So anterior 2/3 is supplied by supplied by this one. আচ্ছা দুজন চলে আয়, তুই দুজন তুই চলে যা। So this is your overall cranial nerve examination test, and you have to, every student can get this nerve test, any all the examining. Okay, some revision will be there. Suppose I am asking that you have to test spinal exercise now, go for it spinal exercise. Before going any test you have to take consent, explain, then start properly. Yes, this is a trapezius testing. Okay, then another three tests will be there. After that, 3 tests. Yes, that is going on for the both sternocleidomastoid simultaneously. It is trying together, and then it is one side, and this is on the opposite side. ऐसे नहीं, ऐसे करना है, ऐसे करना है. Yes, you can use that hand also. Okay, so that is your total spinal accessory test. Before going for your hypoglossal nerve, suppose I am asking you the hypoglossal nerve test. So you have to take some history. Speech history is important because you are asking your name. You will ask what is your name. That means what? Higher function. Before going any cranial nerve examination test, we have to go for the higher function test. But in an examination, high function is not possible. But you have to utter the term that considering my subject having high function test is normal. You have to say that the high function is test normal, so I can go for the proper cranial nerve testing. Now you have to give consent and then proper test. Suppose I am asking you to test go for your hypoglossal nerve. That means cranial nerve 12. Okay, go for it. So first of all, any hypoglossal nerve test, first of all taking history. History में क्या क्या आएगा? History में speech first of all, movement করতে পারে নাকি টাংটা বের করতে পারে নাকি, and then inspections, then palpation. What are you seeing? বড় না ছোট size number 1. Number 2 is the muscles. Muscles here there is an atrophy present or not, because atrophy means lower motor neurons. না এটা এখন না, এটা পরে. Then you have to give the fasciculation for inspection. Involuntary movement, involuntary twitching movement of the muscles of the tongue. Tongue muscle করবে. That is a feature of lower motor neurons type. Okay, so yes, check this, and then you have to ask movement of the tongue all over the movement. মুখের ভেতরে মুভমেন্ট কর, ওকে শো করতে হবে পুরো চিক টিথ জুড়ে, লিপস, yes, that means movement is correct. Then proper motor testing, there is a muscles, there is a resistance, yes, and also in this side, always stand in the right side. Finish. খুব কঠিন হয়ে গেল? It is very very easy. দুদিকে একসঙ্গে হবে না, একদিকে বলবে একদিকে বলবে, টান তো একটাই, ঠিক আছে? সো ইন দিস ফ্যাশন ইট উইল গো মজা যাও। Yes. If it is movement is not there, that means muscle paralysis is there. Muscle paralysis means you know that hypoglossal nerve is there, brain stem problem may be there. দুজন আয়, তুই একজন আয়, হ্যাঁ either. Go for the trigeminal nerve test, only motor part. Trigeminal nerve, only the motor part. এইভাবে examination জিজ্ঞেস করবে, only motor part. কে পারবি? চলে। So you stand there and teach from him, learn from him. You learn from your friend. No, this is not the approach. I am asking trigeminal for the motor. So why you are taking the first your hammer and doing the jaw jerk? There are lots of muscles are there. Muscles of mastications are there. Muscles are mastication. All the muscles of mastication are supplied by the trigeminal except buccinator, supplied by facial nerve. বোঝা গেল? So এই অঙ্কের মতো হিসাব থাকবে, it's mathematics. All the muscles of, so you have to check first your muscles of mastication. If you inform your examiner in this case, 0, big 0, or at least I will give you. So first of all, whenever you are clinics, your mind will be very very cool. Take your time and waste your time. There is a main point is there. Take your time, waste your time, and do the test properly. Finish. Number of questions will come, will be asked less. Number will be much more. Okay. So don't be there over smart. Be smart. Don't be over smart. You are doing like a over smart. So that's the problem is you came across. Jump cool and think for the motor part. Motor part means 3 muscles will be there. Name them. What are the muscle you have to test for? You tell. Kiki. Lateral medial guard, masseter, temporalis. So how to check this? Clenching of teeth. করা ওটা রাখ দাও ये. No, not like that. You have to palpate. So see, this is your class. It cannot be revision. Nobody will take this class, and this mistake will go in the examiner. Do you think if you get in 20, I will give you 0? Whatever you maybe your full marks, you never be pass. I will give you 0 and 100%. हमको तुमको क्या ही देता हूँ. If it is not properly done, I will give you 0, big 0. Because after saying that your muscle will be palpation, you have to palpate that. Do Not like that ওখানে মাসেল আছে, you don't know basically, you say that আমি জানি না, I don't know that you appear this, why you are doing this over smart, একজন চলে আয় যে করতে পারবি। In front of any examiner for your all the professional MBBS, it will be detrimental for your career. Remember that. Because we can read you. Whatever you are thinking, I am reading you. Go for it. So that is your masseter. Very good. Then, now temporalis is above. Temporalis is temporal side. More and more above. This. Yes. This is it. Clinch and then clinch. একবার clinch কর, একবার ছাড়. This is your process. Clinching and release. Clinching and release. Filling and then medial and pterygoid. You are not in seeing, yes, that movement will be there. And first of all, passive, active and then is will be passive. That will be resistance, with resistance. Yes. So that is where medial and lateral pterygoid testing will be there, right? In this fashion, you have to complete the motor part of trigeminal. How can you complete the sensory part? Do it. Sorry, clinch and release, plus. Then first of all you have to think about the divisions. What are the division of trigeminal now? Mandibular, okay. Then ophthalmic. So upper part, first of all ophthalmic, eye related, and then this is maxillary and then mandibular. It's very easy. Ophthalmic, maxillary and mandibular is your divisions, and these division you have to test it for your pain, touch, pressure, temperature, everything. Whatever you are present, you can go for it. Examiner has not much more time that he will continue, but you have to start by giving consent and by explaining what you are doing. Do it. That is very important. Yes. Whether yes. Why the touch now? Yes. Just for touching is it. Yes. You can say that the positions also is right. Locate. Look, you can. No. But first of all, you have to think that yes or no. Is present or not. Okay. Sometimes you can say blindly. That means you are not touching at all, but asking the whether present or not. Do it. First of all, soft touch by using cotton. Yes, that is the important point. As an examiner, I am always searching that whether she is telling that to close your eyes or not. That will give her a good marks. That is the clinics. First of all, he said that close your eyes. That means his sensory supply you are blocking by your visual field. Okay. So stop close your eyes and do it. And just say yes, no, this is wrong. You are taking the division of ophthalmic, then again you are touching the maxillary. No. Ophthalmic, maxillary, mandibular, finish. Okay, so that is systemic. And always remember, in the CNS case, always bilaterally and symmetrically. Do it again. That is a soft, and then it is your crude touch, or you can say pen. You can take anything. No pin is there. No pin is there. No pin is there. So you can do this in this. Explain it in other side. Yeah, it will not harm you. Tell him. Just feel like that. Yes. It is also very, you can say there is a pen test. It is a pen. Basically, pin prick होने भालो अच्छा था. Is a lower. Pen আছে करो pen. Pin বা pen करो अच्छा तो दे. Safety pin. Something एकदम same ophthalmic this. But it will be given in your exam. Is a pin will be there. You can go for this na. You can go for this. This will be better. Nija. First of all, you have to. If you get this side, you have to yes. Okay. So, ophthalmic, maxillary, and mandibular divisions of the trigeminal nerve. But before completing this one of the tests whichever you have started, the jaw jog should be finished. Jaw jog karo, tum aaye the. Do it. You don't know. So you do it. Jaw jog. So always explain. She is doing much better. She always trying to explain and taking time. Consent, introductions, and always explain what you want to do. This is the basic. And this is the site and this is the class where you can get maximum marks. I will give, if it is all over the total fantastic, then 20 out of 19. Out of 20 is 19, 18, 20, 20 you can get from me. And if you totally failed, you can get 0, 1, 2. Go for it. Yes, that is again first point. Open your mouth first, right? Then one finger only. Yes, you can write in this way or in this way. Better is that in this way. In this way. No. Vertically. Yes. Vertically. And using your, no, this one. Yes. The surface area is much more. Go for it. So, this is, if it is brisk, then what does it mean? Any reflex, it is exaggerated, and brisk means which type of neural lesions will be there? Which type of? Upper motor or lower motor? Any reflex is hyperreflexia, brisk and exaggerated is upper motor neural lesions. And any hyporeflexia, absent of reflex, absent of any jerk, it is your lower motor neurons. Okay? Fine. चलो जाओ सब ती थक hey मैं उठे आए examine the trochlear nerve. So taking your time, who is the supplier, to which it is given, and which type of movement of hand it is essential for the test. These things you have to then I have movement, and you have to think about that which type of muscles is it and what should be your movement of hand. Oblique, very good. So superior oblique is supplied by the trochlear nerve. Fine. Superior oblique means, now you have to think, the superior oblique means obliquely, its eyelid will be upward or downward? Downward. Again, another twisting is. Now go for a test and explain introduction first, and then take your consent and then go for the proper test. Don't try to test all the muscles whenever you are asked for the only trochlear, only abducens, because these are only one muscles are there. So only fixed test will be there. Not like that lateral movement coaches, medial movement coaches, upward coaches, oblique coaches, not like that. Superior oblique means one particular hand will be there, examiner will see that. Go for the test. Soya takhabe, this is important. So you have to check straight and your head must be in fix. 2 points she already explained. Nice. মাথাটা না ঘুরিয়ে সেই চেষ্টা করবে, মানে এরকম করবে, আই মুভমেন্ট হবে, নট ইয়োর হেড অর নেক। So it is right. So he is doing what? It is a superior oblique test, obviously. But don't say in front of examiner, sir, this is for your right sided eye, superior oblique, বলতে যাবি না, ওইখানে গিয়ে থেমে যাবে। You have to welcome the questions. Okay, sir, this is your superior oblique test. তখন next question will be which eye? রাইট আই। তাহলে লেফটের ক্ষেত্রে কী হচ্ছে? ইনফিরিয়র রেকটাস হচ্ছে, রাইট? এইভাবে কিন্তু আমাদের এগোতে হবে। দিস ইজ দ্য প্যাটার্ন অফ দিস এক্সামিনেশনস। নাও ইউ গো ফর দ্য অ্যাবডুসেন্স নার্ভ টেস্ট। Lateral rectus supplied, then only one movement will be there. Go for it. আগে স্টেটে নিয়ে আসতে হবে তোকে, কারণ you are doing for the lateral rectus, that is middle line, your hand picture must be there, and then you move your, yes, so rectus for the right eye, but then stop, then not go for the, examiner will ask you invariably, then your what is your interpretation for your left eye? That means you are welcoming your questions and number. If you say everything in one test, the number will not come. Okay, then sit. This is your, this is a lateral rectus test, it is abducens nerve test for the your right eye, right? Now the question will come, the where this lateral rectus muscles nerve, the abducens nerve is your nucleus is present in the brainstem, কোথায় থাকে? Midbrain, pons and medulla মধ্যে কোথায় থাকে? Where it is there? It is a pontomedullary junction. Remember that, because this is important for tuberculosis, tubercular meningitis, exudations causing the compression of this abducens nerve. I have seen many patients and diagnosed as a tubercular may be suspected only seeing this test, right? Not only that, nystagmus is very important. So you are doing any examinations of your eye, it's better to ask some history, right? যেগুলো আমরা কিন্তু মিস করে গেলাম তাড়াতাড়ির জন্য, কিন্তু if you want to kill the time and then get your marks, then you have to say that, sir, I will can I ask some history, vision, double vision present or not, double vision problems is there or not, any vision problem is there or not, looking for the squint, no sir, squint is not there, strabismus is not there, there is no nystagmus, just inspecting the eyes. Okay, then come for the proper test for trochlear, abducens, etc. Right? Chalo jao, come. Show me the consensual right reflex. Show me, question is very clear. Show me the consensual light reflex. Do you know the consensual light reflex? So why you are not in the class? কে জানিস? তুই বল, what do you mean by consensual light reflex? হলো না, হলো, ঠিক বললো না বলছে। What do you mean by consensual light reflex? What is another name of this consensual light reflex? That is important. If you know that, you will do the test. External examiner will ask, oftenly it is asked. That is called indirect light reflex, nothing else. So go for it. Make a group, 2 to 3 groups. যাদেরকে ভালো লাগছে একটা গ্রুপ বানা, they go for the test in the clinical. How can you palpate the liver, spleen, how can you auscultate the chest, how can you see the apex beat, everything. How can you see the BP, pulse points, দিস থিংস উইল বি আস্কড, ভেরি ভেরি ইজি কোশ্চেন, এইগুলোই জিজ্ঞেস করা হবে। ক্লিনিক से কিছু না বলে জিজ্ঞেস করা হবে যে পালসের পয়েন্ট কত, পালসের পয়েন্ট কি আছে, করো, ডু ইট। So before going any test, you have to check whether patient is wearing any spectacle or not. If its specs is there, you have to wear off, and then you have to go for the any strabismus, any type of your. Now এরকম না, হাত তোকে দিতে হবে, how can you close totally, close কর total, এই যে এরকম, হ্যাঁ। And then what will be your test? It is indirect means concentrated. How can you do that? So light will come behind the ear. Yes. But this is wrong. Why it is wrong? Because she is seeing in the same eye of the light. So that is your mind. I have to check the pupillary constriction whether you are seeing or not. No, you have to don't come there. You have to check from here. Yes. No. Again you are doing wrong. Your light will be in the one eye, and your observation will be different eye. So you have not practiced at all. If such type of student came across, clinic se pass kora holo na, will not pass at all. So practice it. যতদিন ক্লাস হচ্ছে, practice it again and again, and go through a good books like Maxillary, Hutchinson, etc. Go for your YouTube also. How can you test this, and you will get. Do it. তাহলে বুঝতে পারছিস এই টেস্টগুলো যদি না করা হয় বা না প্র্যাকটিস করা হয় তাহলে অতটা সহজ নয়। সো গো ফর ইট। ইয়েস, no, not like that. In this, হ্যাঁ, এইখানেতে আয়েতে পড়বে, ইয়েস, তোকে ওইখানে যেতে আরো মুখ কাছে নিয়ে আসতে হবে, ওখান থেকে তুই কম্পিউটার কনস্ট্রাকশন দিতে হবে। ওকে কি বলবি? ইউ হ্যাভ টু টেস্ট এ স্ট্রেট। তুই কি বাংলা একদম বোঝি না? ইফ ইউ listen, 7 months already gone, your patient will be your Bengali means একদম plain Bengali, okay? Then be very careful, otherwise you will not learn. Whatever you maybe the degree, if you, whenever you go your place, what is your place? हाँ? बनारस में तो बंगाली बहुत अच्छा बोलते हैं, समझते हैं। कहाँ पर बनारस में? वो बनारस में प्रॉपर बनारस है वो? नहीं, बनारस में बोल रहे, प्रॉपर बनारस में है। अब लोग रहते हैं प्रॉपर बनारस में रहते हैं, BHU के आसपास कि नहीं? DLW कहाँ पर है वो? मतलब गंगा की घाट फाट से दूर की आसपास? घाट से दूर है, चलो ठीक। मेरा दोस्त रहते हैं वहाँ पर प्लास्टिक सर्जरी में, BHU में है, एसोसिएट प्रोफेसर है मेरा दोस्त, बहुत ही अच्छा दोस्त है। तो ठीक है, तुमको तो समझना पड़ेगा, है ये सब करना पड़ेगा। यू हैव टू टेल, जो बंगाली फ्रेंड्स है उसको सीखिए ये कैसे हम लोग इसे एडप्ट कर सकते हैं। दिस यू आर कमिंग इन टू लर्न इन द बंगाल, बिकॉज इन इंटर्नशिप, इन हाउसटॉपशिप, यू हैव लॉट्स ऑफ पेशेंट्स। इफ लैंग्वेज कम्युनिकेशन विल बी गैप, देन यू विल नॉट, बिकॉज पेशेंट विल टीच यू ए लॉट ऑफ थिंग्स। ऐसे मेरा होता है, ऐसे मेरा होता है, वो ऐसे नहीं बोलेगा। और जैसे कि वो समझ जाएगा कि तुम नॉन बेंगोलीस हो, और तुमको प्रॉपर हिस्ट्री नहीं देगा। जैसे हम जैसे बिहार में जाए तो मुझे थोड़ा बांग्ला बोलेगा, समझ में नहीं आता है, ठीक है? আমার চেম্বারেতে কি করে, আমি যখন বলি বাংলা বলি, স্যার হিন্দিতে বলবো। क्यों भाई? तुम बंगाल में हो, बंगाल में तुमको सीखना पड़ेगा। अगर बिहार में तुम जाओ तो बांग्ला बोल देखिए, होता है, एक भी नहीं सुनेगा, तो क्यों हम सुने? हाँ, बी वेरी वेरी अलर्ट, अदरवाइज कुछ सीख के ना हो जाओगे। डिग्री हो जाएगा शायद, लेकिन कुछ सीख के ना जाओगे। मेडिकल प्रोफेशन is lots of are there without any much degree, but knowledge is high class, and then only you will be a good doctor in your locality, ठीक है? चलो, अभी तो मेडिकल कॉलेज भी हो रहा है, बहुत सारे हो रहे हैं ना वहाँ पर। तो तुमको तो वहाँ ज्वाइन करने के लिए तुमको तो कुछ सीखना है, तो कॉन्फिडेंटली, हाँ मैं यहाँ पर सीखा हूँ, मुझे पता है क्या क्या करना है, करो, ठीक से करो। फेस और थोड़ा आएगा, हम दिखा देते हैं एक बार, ठीक है? एक और। सो मेरा मुंह, मेरा आँख का यहाँ पर रहेगा, ये जो है it will touch in this right eye and my face will be like this. Finish. And you state, no blinking. बस whether you are seeing in constriction direction छोड़ दो, तुमको कोई मतलब नहीं है. Just process is do it. Okay? Practice करो, habit करो. Practice is very very important. हो जाएगा इसमें भी हो जाएगा. Okay, then always do the bilateral. Always test will be bilateral, both side. Which cranial nerve you want to do completely and correctly? It is your choice. It is oftenly asked in your exam. Choice by yourself. Do it by correctly. Either you do within 20, you will get 10. If you fail, you will get 0 because your choice was there, right? So tell me now, within these 12 cranial nerve tests, which one is you preferably you can go except olfactory? Do it. Second, that means optic. Now come, sit down. না না এই তো এটাই করবো, আবার কোন দিকে যাবে, এটাই করবো, এটাতে এটা দেখবো, আবার এটাতে এটা দেখবো, এটা দেখবো, এটা দেখবো, ডাইরেক্ট কোনো ব্যাপার না. তো লাইট রিফ্লেক্সের ইয়ে কি रूट वैल्यू की एफरेंट डिफरेंट के एफरेंट डिफरेंट कौन है? ऑप्टिक इज एफरेंट एंड डिफरेंट इज oculomotor because of constrictions. Sit down well. अरे नहीं जा. Okay, that is the first thing. That is a stand by your right side of your patient. And then consent, and then explanation, then introductions, everything will be there before they going for the test. Optic nerve test means what? And which you will want to do. First of all, your visual acuity, then field of vision, very good. Then color visions, then Ophthalmic last में reflex is there, light reflex will be there. Accommodation reflex is there. Go for it. चलो करो. So what is the name of this chart? Very good. So this is important. Explain and covering the other eye. Okay, if it is specs is there, both tests will be there. With spec, without specs, in both sides. Okay, do it. So is visual vision, acuity of vision is 6/6 in which ear? Which eye? In the right eye. Then again it will be in the left. Okay. Last এটা পড়তে বল. You have to tell if you know that he is reading properly, then you can ask the last line. Suppose a patient comes that the A-টাই সে পড়তে পারছে না, he can't see the A. Then what to do? Finger counting. Very good. Then finger counting is not done. Hand movement, very good. Then perception of light. By that direction of light is coming. And if it is still not present, there is a blind. There is a blind. If it is patient is suppose O and X, second line he is saying, then his field of vision will be 6/36. Clear? It should be totally clear. Okay, this scenario chart is very important. Often it is asked. Nowadays it is computerized, is there for the field of visions, etc. But say power, whether it is cylindrical, etc. It's not your domain. But this is optic nerve test is your field of vision is essential. And this examiner can ask you whether any chart is there, you can perform one cranial nerve test. You have to check the whether strain start is present or not. Okay, that also asked. With the room, there is a clinical class is there, that is the chart is there already present. If it is illiterate, then he cannot know A, B, C, D, 1 to 2. Then
shapes.
Shapes means?
Triangle or rectangle.
No. What chart? For two charts you can use. That is a C chart or E chart. E chart means কোন দিকে খোলা আছে, whether it is open ended. And E is side, E this side, E is side in this way, or C opening of this gap, right? C, etc. In this way you have to check that this one and the illiterate person. So E chart you can say only the E chart, and also sometimes it is the C chart. Then what to do?
Field of vision.
Check. This is the point. So at the level of same level, you want to distance. No, that means you have to, you বলছিল একটু হ্যান্ডশেক করার মতো করতে হবে. So you are asking the handshake distance, both are present. Examiner will see that, and then
Eye contact.
explain first of all.
I will be testing your eye, field of vision. Please maintain proper eye contact with me. And then close the eye, which I am closed. So close the left eye.
Yes, very good.
Close the right.
No,
The same side.
same side, yes. Same side will be there because you are testing the, by considering reference of you. Your field of vision is correct. So you are changing his field of vision of that side. Okay, do it. So practice is very important. দেখেছিস ও জানে তাও কিন্তু এটা কিন্তু totally wrong. So you misjudge that. Okay, that is the practice importance is the clinics. Okay, then
Focus on my finger. See this? Please maintain eye contact. See this?
keep eye contact. Eye movement will be not be there.
See this? Visible? 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 Is this visible?
Try to move like that. See, this movement, this movement, this movement, and this movement. 3 quadrant, upper, middle, lower, and very fast. Upper, middle, and lower in both sides. But you have to check whether you are seeing or not. Do it.
Seeing this one? Seeing this one? Seeing this one? This one is visible? This one? This one? This one is visible? This is visible? This is visible?
Okay. Then,
Close the other eye.
yes.
This one is visible? Can you see this?
Examiner have no much time that both tests will be there. If you gives in confidence that you know that, so examiner will stop you. Okay, কত টাইম নেই এটাই টেস্টের ভিতরে অন্যগুলো কি জিজ্ঞেস করবে, আদার্স কোশ্চেন উইল বি দেয়ার, রাইট? সো দ্যাট ইজ ফাইন. দেন फील्ड ऑफ विजन हो गया. उसके बाद
Color vision.
कलर विजन बाय
ECR.
ECR स्पेलिंग.
ISHI
हाँ
HARAS.
ठीक, apostrophe is ECR. Then how can you show me the test and your subject in front of you? What to explain? ये रख दो.
So this is our color blindness. There are numbers in the circle, inside the circle. You have to tell me which number is written. Right? Which one is this?
ঠিক করছে? কি ভুল করছে? Each eye.
Each eye.
We don't know that this eye maybe there will. Each eye will be there. বন্ধ করো.
Close the right eye. This one. Eye. This one.
At least 3 in both eye.
And this one. And this one. Okay. So the left eye is correct.
Yes.
Close the left eye. What's it written?
Ajay, tell me which test is nowadays done for the check the field of vision? Perimetry. Next, which test you want to do? In case of field of vision, 2 tests are there. Is it? That is a field of vision is this test will be done, and acuity of vision is for the far vision and near vision. For your far vision, this is Snell chart. And which one is your near vision? Where is that? It is actually acts as a Jaeger chart, actually not. Jaeger chart also there. আছে একটা Jaeger chart. So you have to, yes, take. So you have to open the book and ask to read that in the area N6, N area. हिंदी में हिंदी नहीं तो
Sir, for both eyes?
हाँ both eyes definitely. So one eye. Check this. इंग्लिश पढ़ो इंग्लिश इंग्लिश नहीं तो बंगाली जो भी जो है क्या है हाँ so near vision is correct. So it is called which chart? Spelling?
Jaegeers.
Check. It's very important. Which distance? Tell me. Oh, asking. Asking which distance you can say for this. Keep the Jaeger's chart. नहीं. Centimeter में बोलो. What is the 6 meter? You can say 1 meter. It's not wrong, but it's better to ask the 25 centimeter to 35 centimeter within this range. Whatever is the near vision is for the 25 to 30 lesions. And if it is present of spectacles, before spectacles and without spectacles will be there. Both for the near vision. Okay. Then color vision हो गया. Yes. Spectacles. দিয়ে দেখবি স্পেকটেকলস থাকলে স্পেকটেকলস দিয়ে পড়তে পারলো স্পেকটেকলস ছাড়া দেখবি পড়তে পারছে না তাহলে সামথিং প্রবলেম ইজ দেয়ার তোকে এক্সামিনার এরকম দেখবে না তোর আয়ে হবে এগুলো যখন তোর আই এক্সামিন যখন তুই থার্ড ইয়ারে পড়বি আয়ে তখন এই কথাগুলো লাগবে উইথ স্পেকটেকলস উইথ স্পেকটেকলস you have to judge na you have to judge that the patient is suffering the patient will come now your patient is not there it is a subject it is a normal person your friend will be there but in case of word in case of IPD the patient will be there so everything that you are taking the any field of vision with specs SARI without specs SARI then it to interpretations come out then what to do accommodation reflex go for it closer eye can no accommodation reflex there is no close eye accommodation reflex means what accommodation reflex means three components will be right components of both eyes not on single eyes number one number two you have to tell the gaze the distance in far and then suddenly you will took your finger at the 25 centimeter distance not like that because it will if you come close to the eye you will see the diplopia double vision will be there देखो आँख देखो ऐसे डबल विजन हो रहा है सामने जाओ ठीक है सो दैट विल कम एज सडन ऐसे किया ऐसे किया ऐसे किया ऐसे किया हम लोग क्या बोलते हैं कि सडनली हाथ ना देके भी हो सकता है क्योंकि टिप ऑफ द नोज सडनली ऐसा देन टिप ऑफ द नोज सडनली ऐसा सडन स्टेट एंड देन सडनली इन द टिप ऑफ द नोज बट ऑल ऑफ द एग्जामिनर द सीनियर एग्जामिनर स्पेसिफिकली they want to like pen or finger like etc they want so my suggestion is to use a pen first of all you have to gaze the pen keeping the pen in the field keep it straight दूरे तका अतो तुम सही बात में रखो you have to keep in at the distance and then straight and then suddenly the tip of the yes. So what is happening here? Three components. Tell me the three components of accommodation reflex. So 3 C's are there. Ki bolo? Constriction of pupil, number 1. Convergence of eyeball. Anterior curvature of lens increase. Very good. So curvature C, constriction C, and the convergence C. So 3 C's are there, right? Now, what are the components is acting? Basically, convergence of what? For what reason? It is your which muscle? Convergence? এই এরকম করছি কোন মাসেল আসছে common sense which muscle no which muscle is coming ऐसा rectus which rectus medial rectus so medial rectus contraction will be there number 1 number 2 constriction of pupil how constriction of pupil sphincter pupillae constriction of sphincter pupillae right then the convergence iris muscle, ciliary muscle contraction that causing the increasing the curvature of the anterior lens. So this is your accommodation reflex, oftenly asked. Only accommodation reflex do it. So first of all, you have to stand in the right side of patients, consent, explanations, gazing far distance, keep a pen, and then suddenly ask the patients to a subject to see the tip of the pen, and then he or she will ask you about the components of this. Remember, 3 C's will be there. Now, what do you do next? Pupillary light reflex. তাই তো? আর কি করা যায়? Light reflex already done. Direct and indirect. Direct is very easy. Indirect, another name is consensual reflex. समझना पड़ेगा, नहीं तो नहीं होगा. Consensual light reflex, that is indirect light reflex. Then আর কি আছে? Anything else there? Ophthalmoscope last. Ophthalmoscope में क्या क्या देखना है? Optic heads, retinal hemorrhage present or not, etc. It is not beyond your scope, but keep in mind the last optic nerve test without ophthalmoscope did not finish it. Lots of information will be there, right? এগুলো পড়েছি আমি যেগুলো ক্লাস নিয়েছি, আমাদের ক্লাস কে করেছিস আমি জানি না, কিন্তু আমি খুব ভালো করে কিন্তু পড়েছি এই অপটিক এডিমা, এই অপটিক ডিস্ক, রেটিনাল হেমারেজ কীভাবে কী হয়, আমি প্রায় আইয়ের মধ্যে দিয়েছি পড়িয়ে। সো দিস ইজ ইউর অপটিক, তাই তো? আর কিছু তো নেই। So whenever you are going for examination, cranial nerve 1 to 12 will be in your mind. Rennes test, Weber test, facial nerve, trigeminal, spinal accessory, optic nerve, corneal reflex. Corneal reflex কিভাবে করে? How can you do the corneal reflex? Junction. Corneoscleral junction touch the cotton and it will blink. What are the afferent and efferent? Accommodation reflex কি afferent কি efferent? Same. Optic, oculomotor. ওই যে oculomotor গুলো আসছিল বলেই ওখানে medial rectus হচ্ছিল। সিম্পল একদম। আর ট্রাইজেমিনাল ইয়েটার কর্নিয়ালে হচ্ছে ট্রাইজেমিনাল আসবে, হ্যাঁ তাই তো? Trigeminal nerve খুব important for mixed nerve. Facial nerve is important. Lower motor neuron, Bell's palsy important. Bell's palsy and the other lower motor neuron, upper motor neuron palsy, facial nerve, key difference. What is the difference between the Bell's palsy? বল তুই ঠিকই বলছিস কি? Bell's palsy কি হয়? Is ipsilateral and upper and lower both. That is called your lower motor neuron lesions. Remember, Bell's palsy, lower motor neuron lesion. That means infranuclear. But your upper motor neuron lesions in case of facial nerve is something else, that is the upper part. That will happen if upper motor neuron lesion in left side, then your right side lower face will be paralyzed. The lesion will be there. That is called contralateral. Now this side is your lower motor neurons, so both of these upper and lower will be damaged or lesion will be there. That is safe, that is Bell's palsy. But if it is present this side lesion in upper motor neuron means what? It is from cortex to the brainstem or up to the anterior horn cell of the spinal cord. So in case of facial nerve, upper motor neuron means cortex to the brainstem. Right? So up to this area, it is upper motor. If it is lesion, that upper part is given bilaterally. Supply is bilateral, and lower part is come from the contralateral side. That's why if it is happens, this lesion is here, then contralateral lower part will be damaged. Right? Upper part means what? Upper part of nucleus. ওই যে দুটো দাগ দেওয়া আছে, এই ছবিটার যে ভালো করে রক্ত করতে পারবি তার এই কোশ্চেন আরামসে। If any examiner can ask you and give proper answer, it would get huge marks. তুই জিজ্ঞেসই করবে না, তুই ভালো জানিস যা, বোঝা যাচ্ছে? So these things important, practice it first of all, and language problem is don't tell any issue at all at the 7 month of age, because your patient will be there. You have to ask the emergency patient, you have to internship to go for it. इफ यू आफ्टर लिविंग योर बंगाल गो फॉर इट, कहीं भी जाओ कुछ भी बोलो कोई फर्क नहीं पड़ेगा, लेकिन यहाँ पर आपको सीखना पड़ेगा। ओके